Hi, everyone. Welcome to our webinar highlighting PHLC's latest commercial tobacco control resources. I'm Kelly McEnany. I'm a senior staff attorney here at PHLC, and I'm joined by my colleague Luke Hawk, also a staff attorney at the center. And today we'll spend a little time talking about how to best navigate our website and find commercial tobacco control resources, and then also give you a quick sort of sneak preview or recap of some recently released publications. But first, I'm going to take a few minutes to share a little bit about who PHLC is, what we do, and how we do it. Many of you are quite familiar with our work and what we are all about, so we're excited to welcome those of you who are new to us and maybe new to the commercial tobacco control world, and we hope to serve as a resource for you now and into the future. So here's a picture of our beautiful Public Health Law Center campus. We're housed at the Mitchell Hamlin School of Law in St. Paul, Minnesota. And we do want to take a minute to acknowledge that the land where the Public Health Law Center is located is near Bdote, the sacred confluence of the Mississippi and Minnesota rivers, and the birthplace and center of all things for the Dakota people since time immemorial. This is our team. We have policy analysts, attorneys, administrative staff, communications folks, and others here to support your crucial work on the ground. As I mentioned, our physical office is located in St. Paul, but staff members live and work throughout the country. Public Health Law Center works to reduce and eliminate the use of commercial tobacco, promote healthy food, support physical activity, and tackle climate change. Our newest public health infrastructure team aims to strengthen the public health infrastructure throughout the country. And here's a little overview of legal technical assistance, which is what we provide to public health professionals, attorneys, and advocates throughout the country. This legal TA includes help with legal research, assistance with policy development. We also provide litigation support, such as filing amicus or friend of the court briefs in high-impact cases. And we develop publications that explain complex public health and policy issues. We also do webinars and trainings like this one on commercial tobacco control topics. We do many things, but as you can see from the slide, we do not provide direct representation, nor do we lobby. I also want to note that when we talk at the Public Health Law Center about tobacco products, we're discussing industrial scale commercial tobacco products, not traditional tobacco, which is and has been used religiously, medicinally, and ceremonially by many indigenous communities and tribal nations for centuries. And if you want, you can learn more about traditional tobacco by visiting keepitsacred.org. You can see that on the slide. And we do want to take a minute to sort of center health equity in the work that we do. When we're helping to craft various types of public health policies, we remember people are differently situated. So applying the same policy approach across the board may have different effects and outcomes for different groups of people. And of course, relatedly, this is a slide that talks about the social and political determinants of health, which are external factors that help explain why some people are healthier than others. They also explain why the leading causes of poor health and death in the US are largely preventable chronic diseases. The root causes of many of these health threats are linked to a person's opportunity to attain good health and adopt healthy behaviors. Okay, so now for the main event. We're going to spend a few minutes talking about the best way to find our commercial tobacco control resources. So when you come to our website, this is what you'll find on our homepage. And once you arrive, there are a few ways to find commercial tobacco control resources. First, you can access the commercial tobacco resources right from the homepage. So if you go to the main picture, scroll down a bit, under there you'll find a link countering the tobacco epidemic, and that will lead you to more resources and our commercial tobacco page. A second way is to click on the 3 bars in the upper right corner. This will lead you to a menu with a choice to select what we do. So once you click there, you can choose commercial tobacco control, and that again will lead you to our commercial tobacco control page. There's also a chance here to take a shortcut. If you already know what kind of resource you're looking for, you could skip straight to that specific resource. So for example, if you were looking for a current, a recent or upcoming webinar, you could go straight to that section of the website. So maybe you've heard about our wonderful recent webinar a few weeks ago discussing innovative tactics to encourage retailers to adopt healthy retail strategies. So this is where you could find the recording, slides, and other helpful resources on the topic. Or maybe you're looking for a recent post or commentary. For example, last month, we just wrote a commentary about the recent court win in the Baltimore tobacco product waste lawsuit. So the case is moving forward, which is, again, a huge win. And then, of course, we have links to our policy maps, including a 50-state review of e-cigarette regulations, which was most recently updated in June of this year. And finally, the third and key way is to search with that good old search function. You can find the search bar in the top right screen of all of our pages on the website. And this is probably the best way to find something quickly if you already know what you're looking for, or you're generally looking to search for a term but don't have something particular in mind. If you do choose to go to the commercial tobacco control page, once you reach it, this is what you'll find when you arrive. This is our main page. You can either find a relevant topic, and you can see a number of topics listed here. You can remember that they are cross-cutting, some are overlapping, some are very obvious and kind of standalone, like tax or price, and then of course there are state-specific pages that we link to as well. So other topics might fall in between one or more of these, or maybe listed in multiple places. And again, I just remind you of that really helpful magic search bar function. So if you do select a topic, that page will pull up several resources. For example, this is our menthol and flavored tobacco products tab. When you click on it, you'll find FAQs, scans like this scan of local and state flavored tobacco product sales restriction laws, and other publications, as well as several recorded videos. You'll also find links to other related parts of our website, such as this FDA menthol timeline that's also located on our Federal Tobacco Action Center page. And this page includes this, again, this commercial tobacco control page includes resources, including more information about Public Health Law Center's model of legal technical assistance. So it describes some of the work, as I mentioned earlier in the video. And then down below in the footer, there's a section on tools. And so this is a great way to find some of our other tools that are also linked in other places. But for example, the litigation tracker, this is the main place to find that. There's also an administrative action tracker and another opportunity to go straight to our webinars and commentaries. So if you want to stay in the know and make sure you're up to date on any of our latest resources, you could sign up for our monthly newsletter here. And finally, if you want to also stay in the know, you can use these social media channels to see what we're up to. Okay, so now Luke and I are going to highlight a few of our latest commercial tobacco control resources. The first one is a literature review, and the second is an FAQ. And I'm just going to go ahead and get started with the lit review and then turn it over to Luke. We just completed and published a literature review earlier this month that provides summaries of a few recent and relevant studies from 2015 to 2024 on the health risks of nicotine across all delivery forms: combustible tobacco, smoking, e-cigarettes, vaping, heat-not-burn products, smokeless tobacco, and pharmaceutical nicotine replacement therapies. Each item briefly provides an overview of the study's methodology, key findings, and significance. And so the focus of this publication, as you can tell, is on the specific health harms of nicotine. And we've grouped the review into a few key sections. The first section is nicotine's systemic health effects. For example, one of the publications we gathered is an international review that really emphasizes nicotine is far from innocuous on its own, highlighting numerous studies that have demonstrated nicotine can harm multiple organs, especially the heart and circulatory system. In fact, nicotine's stimulatory effect on the cardiovascular system, so in other words, raising the heart rate and blood pressure, and its role in promoting atherosclerosis, make it a serious risk factor for heart disease. And the second section is on nicotine in priority populations. In this section, we highlight one article that finds compelling evidence of adolescent nicotine exposure causing long-lasting changes in the brain and behavior. So animal studies have shown nicotine during adolescence uniquely impairs cognitive functions and alters reward pathways. Emerging human data, so observational studies of teen vapers and smokers, suggest similar patterns, including potential links to attention deficits, mood disorders, and increased susceptibility to other addictions. And the third section is on nicotine dependence and psychiatric disorders. Our review covers an article on the longstanding association between tobacco use and those experiencing mental illness, noting that smoking rates remain 2 to 5 times higher among individuals with psychiatric and substance use disorders compared to the general population. Another part of the review explores the neurobiological foundation of teenage nicotine addiction with a focus on neuroinflammation. The authors describe how the juvenile brain is especially vulnerable to nicotine's effects, including the activation of particular cells, which are central to the brain's immune response and homeostasis, which is another way of saying reaching and maintaining a relatively stable state of balance. They advise that nicotine-induced neuroinflammatory signaling during adolescence may result in long-term neural adaptations contributing to addiction. And now I'll turn it over to Luke to talk more about making a complaint to the FDA. Luke?
Thank you, Kelly. Next, I'm going to walk you through another one of our recent publications, one that delineates how to submit a complaint about violations of federal tobacco control laws, specifically the Family Smoking Prevention and Tobacco Control Act, the Prevent All Cigarette Trafficking or PACT Act, and the Tobacco 21 law. To start, the Tobacco Control Act imposes numerous requirements on cigarettes, e-cigarettes, and other tobacco products. For example, the law banned flavored cigarettes other than menthol and also requires companies to obtain marketing authorization from the Food and Drug Administration before selling tobacco products. A violation of this act, therefore, could look like a retailer selling flavored cigarettes or a company selling e-cigarettes that lack FDA authorization. Second, the PACT Act prohibits shipping most tobacco products through the U.S. Postal Service, and it mandates age verification if other shipping methods are used. Sellers must also follow local tobacco control laws wherever the products are delivered. So, for example, if a locality bans the sale of flavored tobacco products, then the PACT Act prohibits the delivery sale of flavored tobacco products into that jurisdiction. An example of what a violation of the PACT Act might look like is a tobacco product being delivered to a consumer without an adult signature being required for the delivery. Finally, Tobacco 21 raised the federal minimum age for purchasing tobacco products to 21. Retailers must check photo IDs for anyone under the age of 30 and cannot sell tobacco products through vending machines or self-service displays in places in which people under the age of 21 can enter. An example of a violation of Tobacco 21 might look like a retailer not checking the ID of a minor at the point of purchase. Our resource on how to submit a complaint directs you to a web portal for complaints involving the Tobacco Control Act and Tobacco 21. So I thought I would walk you through what the process looks like if you use that portal. This is what the opening page of the FDA's portal for submitting complaints looks like. And this portal specifically helps the user fill out form FDA 3779. As you can see, there's an option to submit it online. There are also options to do so by email, phone, and mail. This is the first screen you'll be presented with if you click into the portal. Fields to fill in include the date of the violation, the state where the violation occurred, the tobacco product name, and the product type. Product type has a drop-down menu that includes the following: cigar tobacco, cigarettes, cigars, hookah, pipe tobacco, roll your own tobacco, smokeless tobacco, e-juices, and electronic nicotine delivery systems, which includes advanced refillable personal vaporizers, e-cigarettes, e-cigars, e-hookah, electronic pipes, and vape pens. There are also options for other and not provided. If you keep scrolling down the first page, you'll come to potential violation type. The potential violation types are sales to minors, flavored cigarette sales, advertising, labeling, promotion, or marketing violations, free samples, sale of cigarettes in packs less than 20, vending machine and direct access to cigarettes, smokeless tobacco, or other covered tobacco products, self-service display or direct access to cigarettes or smokeless tobacco, unsure, and finally, unauthorized tobacco products. For the drop-down menu that asks for who potentially violated the law, the options are distributor, importer, manufacturer, retailer, and unsure. Aside from providing the name, address, and type of violator, this page also includes a space to add a website for the violator. Other than that basic information, the only other thing this portal asks for is your contact information. You're also able to select an option to remain anonymous and not be contacted. For the PACT Act, the process for submitting complaints is pretty straightforward. You simply send them to the email address for ATF or alcohol, tobacco, and firearms provided on the screen. The ATF website providing this email address doesn't specify what material to include in your complaint, but some possible items that might be worthwhile to include could be the type of violator, such as a delivery seller or a common carrier, the type of product, the date of violation, and a citation to the specific provision of the PACT Act that was violated. You can also see if your state's attorney general has specific instructions for submitting complaints about PACT Act violations, as the Act charges state attorneys general with pursuing violations. A good starting place is nag.org, which is the website for the National Association of Attorneys General. Its website lets you search for your state's attorney general and find further contact information. And finally, it's worth adding that federal agencies do indeed find information submitted in complaints useful. They help the agencies understand what conditions are like on the ground and also help with things like spotting repeat offenders. You should therefore be encouraged to reach out to these agencies if you believe you have knowledge of a violator, and hopefully this webinar has provided you with clear steps of how to do so. That concludes this webinar. Here's our contact information if you have any questions about these resources or anything else. Thanks for joining us. We'll see you at the next one.